Have you ever heard of a sex mechanic? Yeah, a sex mechanic. You see, I've been an orthopedic and pelvic health therapist for 23 years, but most people have no idea what a pelvic health therapist is. My traditional Indian parents, they're still pretty clueless about what I do. I mean, they know I'm a physical therapist, but I kind of left out this minor detail where I work on people's private parts. As a pelvic health therapist, I fix issues around the spine, the hip, the pelvis, and the core, which helps people have better sex. So you see, I'm basically a sex mechanic. One of my favorite philosophers, you've probably heard of him, Justin Timberlake. He talks about bringing sexy back. But how do you bring sexy back if sex sucks? Because it hurts. If for a woman, it can feel like a spiny cactus. And for a man, the grip of a Venus flytrap. This is surprising, but according to the American College of Obstetricians and Gynecologists, 75% of women will have pain with sex in their life. And men, you can have pain with sex too, but for some reason, you just don't like reporting it. So why am I, a physical therapist, talking to you about this? Because painful sex can be a muscle issue. People ask me all the time, Hina, how in the world did you go from treating broken leg bones and move up, literally, to treating the nether regions? So I'd like to share with you today what you can do if you ever have a painful sex issue by telling you about the patient that helped me essentially lose my career virginity and also my own personal struggle with this. In 2001, I had taken a job in New York City. There was this patient, he had a fall and was having tailbone pain. Let's call him Milo Downhurts. Milo had tried every treatment. Nothing was working. Nobody in my clinic wanted this case, and since I was the rookie, I was voluntold to see him. This was my first job, and I really wanted to make a good impression. So that day, I'm poring over all of my materials and training from grad school. There's nothing on this subject. By chance, I come across this small excerpt suggesting that the best way to treat the tailbone was by using a looped up, cloved up finger, go up the butt and move the tailbone. Yeah, up the butt. And I'm like, I gotta do what? My colleague looks over and she's like, OMG, you have to do what? Milo the next day says, wait, you wanna do what? Now, you have to understand, this is not something that is routinely performed at a sports physical therapy clinic. And I'm thinking, if I don't get this right, I could get fired. And then I might have to move back home. And what if my dad sends me to India to have an arranged marriage? Okay, mini crisis over. So I very confidently tell Milo that moving his tailbone from the inside is our best option. He agrees, hesitantly. But after a few visits, he's feeling better. And he mentions to me that he had also been having testicle pain after sex for some time. But this too now was weirdly improving since we started treatment. And he asks, do you think there's a connection between my tailbone and my testicle? My first thought was, did he just say testicle? My second thought was, no way, this is pure coincidence. But I happen to be talking to a mentor of mine, and she confirms that, in fact, there is a connection between these two. And now, I'm fascinated. I read every book, I took every course I could. I even got involved in research to learn about a group of 14 hidden muscles in your pelvis known as your pelvic floor. These muscles attach, kind of like a trampoline, from the bottom part of the spine and tailbone across to both hips and to the front of the pubic bone, giving support to the rectum, the bladder, and the sexual organs. You can feel these muscles when you hold back your pee. Go ahead, I know some of you want to try it. Direct access to these muscles through the back door in men and through the front and back door in women. And so for my patient Milo, moving his tailbone from the inside affected the pelvic floor muscles that attach to it and reduced his pain in both places. And so men, like Milo, you too have a pelvic floor. Now I know what some of you might be thinking. Pelvic floor, isn't that like a Kegels thing? So we're gonna do a little exercise. And I promise, no lube or gloves involved. Please make a really tight fist with your hand and keep holding it until I tell you to stop. And I promise I'll tell you to stop. Conventional wisdom is that pelvic floor strengthening exercises, aka Kegels, improve sex. There are even intimacy coaches out there teaching super Kegels, promising to give you sex superpowers. Keep holding that fist. Kegels might be fine when you're not in pain, but when it comes to pain with sex, Kegels can make things worse. Because when pain is involved, it's because these pelvic floor muscles are way too tight. That tightness, like your fist right now, causes a lack of blood flow, which makes muscles unhappy. And unhappy, tight muscles cause pain. How's your fist feeling right now? Pretty uncomfortable? Yeah, you can let go of it. Doesn't it feel so much better to let go of that tension? And so the Milo maneuver did just this, reduce tension in these tight pelvic floor muscles. When I started my private practice, I gained this reputation as the person that was happy to see genital pain patients. Over time, the cases became crazy complex. Along with genital pain, my patients were having pain all around and inside their pelvis. I was frustrated because I couldn't always fully help them until I became my own patient. After the birth of my son, I developed chronic vaginal pain from a tear during my delivery. Eventually, everything hurt. My back, my butt, my bladder, everything from here to here just felt like it was falling apart. I couldn't walk, sit, or go to the bathroom without pain. Most days, I didn't even want to hold my own son. And sex? You gotta be kidding me. I was running around from one provider to another, a gynecologist for my vaginal issues, a spine doctor for my back pain, and a urologist for what seemed like a bladder infection, yet all the tests were negative. My symptoms were like puzzle pieces, and nobody knew how to put them together. I was tired and exhausted, but lucky for me, I remembered, this is my body, and I'm my own expert. So I started experimenting and treating myself. Over the next several months, my pain slowly improved. But in this time, I got a small dose of what so many of my patients go through, often for years. The shame, the guilt. I felt that. And I now knew what it was like to be in their shoes. Or their underwear, for that matter. I fit the puzzle pieces together when I treated myself. I got my sexy back. And now I was determined to help others get theirs back. This experience really pushed me professionally to look at the body as one big system. My practice became holistic because this is what I learned. The organs, the muscles, and the nervous system, they're interconnected. They talk to each other, which means they affect each other. Here's something you can likely relate to. The crazy opinionated family member. You know, the one that shows up at a dinner party, talks way too much one-sided politics, and gets everyone fired up. When the pelvic floor muscles get tight, they can affect all the other muscles and organs and nerves around them. And then they become unhappy, tight, and painful too. So it's not uncommon for many of my patients to come in with multiple areas of pain and stiffness, along with pain with sex. And what's even more mind-blowing is that these balled up tight muscles, like your fist before, can mimic things like a yeast infection, a urinary tract infection, or prostate pain in men when there's no infection there. And so reducing tension in these tight core and pelvic floor muscles can be huge in not only resolving that low back and hip pain that you've been having, but also improving your sex lives. And this is a big thing that I did when I treated myself, reduce tension in these key muscles. Healthcare providers may not always understand this connection between muscle, pelvic, and genital pain. In fact, according to Yale Medicine and the Indian Journal of Urology, it can take 7 to 11 years for people to get any sort of diagnosis or answer to their pelvic and genital pain. I consult with people from all over the world online, and it's the same thing that I hear. They've seen multiple healthcare providers, had tests and procedures that don't show anything, been on antibiotics and medications that don't seem to be helping. What they need to consider is that their core and pelvic floor might need a little balancing, a little alignment, or a tune-up from a sex mechanic. So who can use a little inspection in the land down under? A little while ago, my team and I decided, hey, let's create like 5 educational YouTube videos for some of our online courses. We created 70. So it seems like everybody can use the little pelvic floor TLC. But since I can't name all of them right now, here are my top 5 groups for those who should consider treatment. Number 1, if you have pain with sex, this can be really any penetration, tampons or intolerance or discomfort to gynecologic exams. Number 2, if you've given birth, you just pushed a watermelon out of a walnut, or it was cut out of you. Trust me, your vagina and core have PTSD and might need treatment. Number 3, if you have any pain or issues from really here to here, this can be any muscle injury, any surgery or radiation, inflammatory pain conditions that affect the pelvic organs or the GI system, like endometriosis or irritable bowel syndrome. It might not be your mother-in-law's cookie. Scar tissue and muscle compensation can have a ripple effect and eventually lead to pelvic floor tension. Number 4, if you've had negative sexual experiences, with the right combination of treatment, sex can become an important part of your life again. And last but not least, number 5, my butt clenchers. I see a few of you out there now clenching your butts. Chronic butt clenching posture can lead to pelvic floor tension and eventually sexual dysfunction. Now we all have a good reason to check out each other's behinds. So if pain with sex is not normal, what can you do right now? I have a clever acronym. Sex. S. Stop clenching. And I mean everything. Stop sucking in that ab. Stop overworking that butt. Stop clenching the jaw. And no more Kegels until your pain is under control. E. Empower yourself. It doesn't matter if you live here in Alabama or in Africa. This affects people all over the world. Find your voice, get help, and get educated because you're not alone. And most important, X. Expert pelvic health therapy, virtually, in person, or with online coaching, consulting, and courses. This can be invaluable to making sex fun again. You get one body in this life, just one. Love it, listen to it, learn how to heal it. Make this the time you bring your sexy back. Thank you.